This is One on One. Hi, Steve Adubato coming to you from the offices of the Robert Wood Johnson Foundation in Princeton, New Jersey. We are here with the President and Chief Executive Officer of the Foundation, Dr. Risa Lavizzo-Mourey. Thank you for joining us.
Good to be with you, Steve.
Doctor, the first half of our conversation, we talked about a whole range of things, but in this conversation, I want to talk to you about the fact that you said that there are leaders that we need to lead what has been called this new direction for the Foundation toward a culture of health. Mm-hmm. What do you mean by these leaders? Who are they? Isn't it just physicians? Isn't that enough?
I am a physician, so I can say this. No, it's not enough. We need leaders who understand the full continuum of care and how to bring health to where people live, learn, work, and play. As you know, the Robert Wood Johnson Foundation has been invested for a long time in developing nurses as those kinds of leaders. There's really a dearth of opportunity for all of the capabilities that nurses have. And that's why we invested in an Institute of Medicine report that really charted a course for nurses working across the fields in healthcare, to be sure, but also for developing leadership in governance and boards and the quality of care that we know can be enhanced if you have nurses at a leadership level. So nurses, to be sure, we have a tremendous investment in developing a campaign for advancing the role that nurses will have in healthcare. But it goes beyond that. It goes beyond that.
Go ahead.
So many times the leaders that will actually improve the health of a community, whether that's a city or a state, are people that don't think of themselves as focusing on health. Earlier I mentioned architects and urban planners, but
in our first interview,
I mentioned that. But think about educators. The best predictor of a person's health is their educational attainment. And so if we can imbue in our educational leaders a sense of what they can do to improve the health of their students and ensure that they actually get higher educational attainment, we will tremendously improve the health of our country. So that's why, for example, the city of Spokane, which a few years ago had a high school graduation rate of 60%, said this is probably the most important health task that we can take on, improving the graduation rates of our students. And so they took it from 60 to 85.
Hold on, I'm sorry for interrupting, Doctor. The graduation rates wind up being a health issue?
We've done a study that showed that if we could get everyone to graduate from high school, the health of our country would increase, and the cost, the amount of money we spend on healthcare services would decrease. So yes, education is a health issue. Just to speak to why we have to have leaders across so many domains and sectors if we're really going to improve the health of the nation.
And that's what the culture, when the Foundation, when you and your colleagues at the Foundation talk about a culture of health, it's really expanding the definition of health way beyond the way most of us talk about it, think about it, act upon it.
That's right. When I talk about this with people, they say, you know, we've got to create a seismic shift in how we think about health, and it's got to come from the ground up. And that's the part that really resonates with people, it coming from the ground up. Having our leaders be able to recognize how to make health the easy thing to do, not the hard thing to do on a daily basis. And that's going to require a different kind of leader, and a leader who thinks about health as a central value for all Americans.
You know, Doctor, the other part of the health initiative, as someone who was born and raised in the city of Newark, who remembers some supermarkets and some grocery stores in the neighborhood I grew up in.
That aren't there.
Thank you. You know, the foundation's been very committed, and people use the term food desert so easily, but to deal with and live in a community that is a food desert is a totally different story. That has been a high priority for the foundation. In the city of Newark, there's a ShopRite, right? It doesn't sound like a big deal, but it's a huge deal. Talk about the relationship between the Robert Wood Johnson Foundation, the ShopRite in the city of Newark, and dealing with this issue of a food desert. Put that all together.
First of all, if you don't have access to affordable food in your community, you have a higher probability of being unhealthy, being obese, and spending way more on food than you should. So how do we change that? Well, first of all, you have to understand how to plan for, finance, build, and sustain supermarkets that can provide affordable food in neighborhoods. And the foundation participated in all of that by working with the New Jersey Economic Authority to develop the New Jersey Food Access Initiative that helped plan grocery stores like this, do the analysis that let people understand it could actually make money, create jobs, and create access to affordable food. And then on the back end, to analyze what happens in a community when you have a new grocery store. And what happens, quite frankly, is it becomes an anchor, an economic anchor, but then also you can demonstrate that people do actually eat differently. They eat more fruits and vegetables. The amount of money that they have to spend on getting healthy food goes down, and all of that improves the health of the community.
That's a culture of health.
That's a culture of
big part
health.
of it, right? Last question I have for you. We've had several conversations, and we're actually meeting today. We're here coming to you from the offices of the Robert Wood Johnson Foundation in beautiful Princeton, New Jersey. In a little bit, we're going to be sitting down with the president of the New Jersey Hospital Association, Betsy Ryan, who talked to us a while back when you were starting an initiative with the Hospital Association. I know others were involved as well, employing veterans in helping to enroll people in the Affordable Care Act, the ACA, if you will. Explain to us that initiative, why it's so important, and where it is today, because we started to talk to Betsy, this is a while back, why that initiative, why the foundation involved, and a lot going on there.
One of the things that we found out early on after the Affordable Care Act was enacted was that people didn't understand their benefits. They didn't understand that there would be help, financial help available to them. And we also learned that the best way for many people to learn about that is one-on-one with someone that they trust. You pair that up with the fact that we have millions of veterans who sadly are looking for a way to re-engage in their communities, and this was a match that we could envision. Teaching the veterans the details of how to enroll people, how to find out what their needs were and pair them up with their benefits. That was done very effectively in New Jersey. And as a result, when you look at the uninsurance rate, it has plummeted in New Jersey. We have one of the lowest rates of uninsured in the nation, in part because of the benefits, but also because of that one-on-one engagement that these veterans were able to provide for people who didn't know about the benefits that they had, but once they knew, they were able to get enrolled.
And veterans are employed.
And veterans are employed. It's good for everyone.
Well, Doctor, I want to thank you. You know, I know that we scratched the surface of the work that the foundation is doing, the impact the foundation is having, but we appreciate you taking the time, and on behalf of everyone in the world of public broadcasting, I want to say thank you for everything you've done for us to allow us to help inform those who care and those who don't know they should care about important issues impacting their lives, medical, health-related issues. And as we attempt to all try to build a culture of health, I want to thank you for joining us. Thanks.
Well, Stephen, I want to thank you for making sure that people know in such an important and informed way that you provide. Thank you.
We are coming to you from the offices of the Robert Wood Johnson Foundation. We'll be right back right after this.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by the Robert Wood Johnson Foundation, MagnaCare, Josh S. Weston, TD Bank, New Jersey Natural Gas, New Jersey Manufacturers, and by Fedway Associates. Promotional support provided by the Star Ledger, powering NJ.com, and by Commerce Magazine. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.